It's a Tuesday morning in Rwanda's eastern province. It's a rainy season. The clouds are clearing and the farming family is preparing for their day in the fields. Kamanzi, his wife, and their two children, 8-year-old Rukundo and 12-year-old Mahoro, gather their tools and head out to work. They reach the cassava fields and begin their work. Kamanzi digs, his wife plants, the children help nearby. 30 minutes in, everything changes. Mahoro screams. Her parents and brother run to her and find her on the ground, clutching her leg. A large viper slithers away into the grass. 2 puncture marks, blood everywhere, her leg begins to swell immediately. Kamanzi scoops her up, rushes her to the nearby health center. By the time they arrive, Mahoro is losing consciousness, drooling, and her breathing is shallow. The nurse works quickly, checking her vitals, starting an IV, searching the medicine cabinets, but they don't have antivenom. They need to transfer her to the district hospital, which is 30 kilometers away. The ambulance races down rough roads while parents pray she makes it. At the district hospital, the doctors do everything they can: blood transfusions, fluids, oxygen. Upon checking their medication stock, they discover they don't have antivenom either. It's been out of stock for 3 weeks. The closest supply is in Rwanda Hospital. Too far, too late. Mahoro dies before the antivenom can arrive. Her family collapses, the mother can't stand, the father hands shake. Rukundo doesn't understand why his sister won't wake up. They mourn not just a child, but a future teacher, leader, doctor, a future member of society who will never get a chance to grow up. Mahoro is not the only one. In Rwanda, snake bites are the second leading cause of animal bites. Every year, 4.3 out of 1,000 are affected. 82% of victims are farmers, often working barefoot in the fields to feed their families and their communities. Most of these bites happen in the early morning or late afternoon when farmers are working and snakes are most active. But when someone is bitten, the healthcare system often fails them. Only 8% of healthcare facilities have antivenom in stock, and even when it's available, it's often the wrong kind, made for Asian snakes, not the African vipers. Only 13% of snakebite patients ever receive antivenom. The rest rely only on traditional healers or hope the venom isn't lethal. This isn't just Rwanda's problem. Across sub-Saharan Africa, snakebite envenomation kills up to 2,000 people every year. Millions more are left disabled or disfigured. Most victims are farmers, herders, and children in rural communities. Yet snake bites remain invisible. It's underfunded, under-researched, and undertreated, a hidden crisis that destroys lives in silence. But these are preventable deaths. There are solutions, simple, effective interventions that can save lives. First, protective footwear. Providing boots and shoes to farmers reduces snakebite risk by up to 70%. A pair of rubber boots costs less than $10. A single life, which is priceless. Second, antivenom access. Every health center needs to stock African Prevent antivenom, the right medicine for the right snakes. Healthcare workers need training on how to recognize envenomation and administer treatment quickly. Innovative solutions like drone delivery systems, learning from zipline success delivering blood for transfusion, can bring antivenom to remote areas in minutes instead of hours, turning a death sentence into a survival story. Third, community education. Teaching people to recognize venomous snakes, avoid high-risk areas, wear protective clothing, and seek immediate medical care when bitten. Knowledge is prevention, and prevention is survival. Mahoro's death was preventable. The antivenom existed, the knowledge existed, but they weren't where they were needed when they were needed. Let her story be the last. Equip every hospital, educate every community, protect every farmer. Snakebite is preventable. Let's break the silence.